Hello, my name is Jaimin Shah, and today I'll be presenting about my currently ongoing research paper. My project aims to answer the following question. How did rules and regulations around the COVID-19 virus impact health and economic outcomes between New York State and Texas? First, I will contextualize this paper. In early 2020, the COVID-19 virus swept across the world, including the United States. Conditions quickly declined in the United States, causing a nationwide lockdown in March of that year. In response to the national health emergency, the federal government spent about $5 trillion between 2020 and 2021 on several massive bills, such as the CARES Act and the American Rescue Plan Act. In the United States, a federalist approach was taken to combating COVID, meaning some measures were taken by the federal government, but many others were left up to the authority of the individual states. During the pandemic, the federal government's main steps involved astronomical amounts of fiscal spending to accomplish goals such as beefing up social safety nets and funding health causes and initiatives. Meanwhile, public health mandates and requirements were controlled by state governments. Looking at health outcomes on a national scale, America experienced about 104 million total cases and approximately 1.1 million fatalities due to the virus. Additionally, the monetary inpatient cost on the healthcare system was estimated to be $70 billion. Notably, this estimate fails to include outpatient care costs, other costs such as those for immunizations and testings, as well as more abstract costs such as the costs of lost workdays and that associated productivity. Altogether, this highlights the true scale of the strain the virus had on our national healthcare infrastructure. From a macroeconomic perspective, the US underwent an incredibly steep decline in GDP and unemployment. While unemployment peaked at 10% during the Great Recession earlier this century, unemployment peaked at a whopping 14.8% during the early months of the COVID induced recession. Furthermore, GDP in 2020 dropped 3.5%, the worst since 1946. While COVID brought the United States economy to lows that hadn't been seen since the Great Depression, the nation also saw a speedy recovery back to pre pandemic trends. The caveat there was being inflation, which, since 2022, has been the main long term economic issue. This was crystallized by Gallup polls reporting that in 2022, inflation rose to be the second most pressing issue for Americans, and in 2023 and 2024, it topped the list. Closing out a contextualization on economic outcomes, the private sector also experienced significant impacts. The visual on the screen conveys that industries with a great stress on in-person gatherings and congregations, such as dining and recreation, saw the greatest declines in business, many reaching decreases in the 40 to 70 percentage point ranges. A last note about the private sector was that small businesses disproportionately bore the brunt of the general private sector struggles caused by COVID. Moving on to the specific states this paper will focus on, New York and Texas were selected for two reasons. First was their scale. New York and Texas both have populations in the tens of millions and economies with GDPs in the trillions. Secondly, these states have diametrically opposed political leaderships, which caused them to adopt very different approaches in response to COVID. First, while New York adopted for increased centralization in their approach, Texas opted for a patchwork system, allocating more power to local governments to put out rules and regulations. In terms of public health measures implemented, both of these states initially went for similar strategies to other states in the US, engaging in lockdowns, shutdowns of public spaces like schools and bars, and imposing mask mandates. This was highlighted by an October 2020 ranking of the relative strictness of states in terms of social distancing measures. New York was ranked 38th, while Texas was ranked 35th, both in the above average range. However, by April 2020, a month after Texas did away with all their regulations, Texas was ranked 5th in terms of states with the fewest COVID restrictions, while New York was 46th. While New York increased measures by surges, Texas ended their measures for good quite early. In March 2021, Texas reopened their state 100%, getting rid of all previous executive orders and following their state's overwhelmingly internal conservative pushes. This differed from New York State, which reopened in the summer of 2021, but after a winter surge in the winter of 2021 to 2022, reimposed many regulatory measures. In spring 2022, New York State reopened for good, 2 years after the pandemic began and nearly a whole year after Texas. Covering discussion and analysis, my paper will look at two realms of outcome. First will be health outcomes, which will involve simpler metrics such as cases and deaths, but also more complex markers, those being the impact COVID had on the healthcare systems of the two states, as well as on the elective medical procedures in these states. The second area of outcomes will have to do with the economies of New York and Texas. The first lens will be macroeconomic, delving into economic activity in terms of GDP, unemployment, and inflation. The second lens will be on the private sector, evaluating impacts on industry from the perspective of different sectors, as well as the perspective of size, targeting the difference between larger corporations and smaller businesses. To conclude this presentation, it would be wisest to convey the importance of my future findings. I believe that an analysis between Texas and New York State will offer American policymakers an in-depth understanding of how the two large active states fared by adopting different models in response to the virus. In both states, it was necessary that initial restrictions be put in place. However, each of these states took their own levels of caution moving forward and ended up on nearly opposite ends of the stringency spectrum. Currently, in a post-COVID world, experts are sounding the alarm, saying that for a variety of reasons, the current world is at serious risk of another pandemic in the near future. In a future where another public health crisis arises, my paper's findings will help guide lawyers, lawmakers on how to best navigate the quantity and strictness of their combative measures, given the dual goal of protecting health and maintaining the economy. Furthermore, these findings can help identify key areas where creative approaches can be taken to balance outcomes between both health and economic well-being. Finally, the findings within this paper, both nationally and state-specific, can be utilized in the near term as a basis for proactivity. The various issues brought to light, ranging from America's role in the global supply chain to general mental health deterioration, can be of great use for lawmakers to target with intensity in efforts to promote preparedness for the future. These are my sources.